got very interested in the nervous system and the brain and the control of what went on. And I wondered for a while if I might be a neurosurgeon. I had an uncle who was a neurosurgeon, but I figured out they spent all the time in the operating theatre and in the dark half the time, and their patients mostly didn't talk to them afterwards. Ophthalmology, on the other hand, was really exciting developments with the development of microsurgery and the first group to be using laser. And to restore sight to the blind was almost biblical. And I'd had a family connection with my grandfather, had been an ophthalmologist, and I'd spent some time as a medical student one summer working with Jerry Crock at the Eye and Ear, and I just fell in love with ophthalmology. It's really supported the ophthalmic research and that's happened in Australia, and it's made a huge difference to the work across the whole field of ophthalmology. From my perspective, one of the things that was really important was the early work we did on Indigenous eye health and trying to close the gap for vision. But they've also done fabulous work on genetic research, on macular degeneration, on improving cataract surgery, on the treatment of glaucoma. So a wide range of people researching all across the country. And Australia is one of the leading eye research countries in the world. In many ways, we've solved what we need to do with cataract and cataract surgery, and that used to be the major problem. We have major problems still with macular degeneration and glaucoma. And there is terrific research that's going on to find better ways to treat the earlier stages and to monitor those at higher risk in both those diseases. And I think that is going to make a major turnaround in the amount of unnecessary blindness in our country and around the world. Well, I think there are two ways of looking at it. On the one hand, the research that's being done on the genetics and in introducing new genes or safer genes into people so they don't go blind is very, very exciting and important. But exactly at the opposite end of that is we also need to make sure that what we know is being put into practice. So we need to be able to educate the community, educate primary care practitioners so that the new advances and developments are actually outreaching the community and the other health providers. At the moment, some 85% of blindness and vision loss is unnecessary. It's preventable or treatable. And so we need to do the research so that we can make sure that we prevent or treat those conditions the most effective way and to make sure people who need care are able to receive it.